All right, good morning, everybody. Thank you so much for joining us for the next installment in our virtual event series this year. We are very excited to have Joyce Linnen with us as our guest speaker today. And it's a couple minutes after 12 o'clock, so we are going to go ahead and get started. This year's theme for the virtual event series at Lions Vision Services incorporates diabetes into the programming because of the increasing prevalence of diabetic retinopathy and the impact that diabetes has on an array of vision and eye care conditions. It takes a increasingly diverse and comprehensive array of partners and community resources to help clients that have diabetes get equipped with the resources that they need to manage that condition and to help address their overall health and well-being. We're excited to have Joyce Linnen with us today to talk specifically about navigating diabetes through support groups and communities. Joyce Linnen is the Executive Director of the Georgetown Diabetes CORE Group, which is a nonprofit organization in Georgetown County that provides underinsured diabetics in the community with supplies and resources to help with the day-to-day management of conditions associated with the disease. Joyce is going to give us a presentation and an overview on this topic today, and there will be plenty of time for questions and answers at the end of our program. So if you would like to submit those questions in the chat, if you'll begin those questions or that chat comment with a Q so that we'll be able to flag those, we'll have plenty of time to address those questions at the end of our program today. And we again thank Joyce and thank the Georgetown Diabetes CORE Group for partnering with Lions Vision Services for this event and for our ongoing work in the community. Joyce, thank you and welcome.
Thank you, Daniel. Thank you so much. First of all, I would like to say thank you to Daniel and the team at the Lions Vision Services for allowing me this opportunity to speak with you briefly about the Georgetown County Diabetes CORE Group and the work we do in the community. Again, thank you, Daniel. Well, first, let me tell you a little bit about us. The Georgetown County Diabetes CORE Group is a very small nonprofit grassroots organization that has been founded about 25 years ago. We've been in the community working for about 25 years. How we first got started, the former director, founder of the organization, Ms. Joyce Linnen, was a lady who went to a training with the South Carolina DHEC. And the training was called Diabetes Today. And what that training was about is about lay members in the community learning and educating them about diabetes. So as a diabetic herself, she attended a training in Columbia, and it was a 2-day training where lay people, regular community people, can be trained on educating their peers and family members in the community about diabetes. So after attending the training, one of the things you were supposed to do is go back into your community and form a group. There were like about 12 people in that group. And Ms. Florine, like I said, who was the founder of the organization, stated that she learned so much in those 2 days that she had known over 10 years being a diabetic herself. So with the information she learned, she came back into her community. She first started with her own church, and she found out that there were several other people in that church that had diabetes. She said in her church alone, she said it was about at least 12 people. When she got up, made an announcement and asked, and that's when she discovered there were people in the church dealing with diabetes just as she was. And they had a little meeting. They came together, had a meeting, and they started from there, and they went on and meeting at different community settings, faith-based settings, inquiring about people who have diabetes. So to kind of sum all that up, that's how we got started, just from her going to this training, a 2-day training where she learned so much about diabetes. And like I said, as a diabetic herself, the information she learned that 2 days was more information that she received over the whole time period she was a diabetic. And she discovered more people in her area were diabetics. So diabetes core became her heart, her passion. And so she started doing some work on her own, no funding, just trying to inquire about people who have diabetes. And they were coming together in a group setting, talking about diabetes and how diabetes affect them. And after doing that for several months, DHEC, the same group, found out what she was doing and came in and started offering technical assistance with her. And her program expanded. More and more people got involved, and more people got, wanted to start talking about diabetes. Back then, in that community, living in rural areas of Georgetown County, that was something that was never talked about. People just was diagnosed with the disease and they kept it a secret, per se. So as keeping it a secret, after she was bold enough to start stepping out and talking about it, everybody started talking about it. And then everybody started getting aboard of what she was doing. And they thought the idea was so wonderful. And she went on and do it. And like I said, after be working with DHEC and TEC offering their technical assistance, then a lady from MUSC heard about her work, who worked with DHEC as well. And that lady, Dr. Carolyn Jenkins, called upon her and offered her a position at the Medical University of South Carolina College of Nursing, where they had just received a very large, substantial grant from CDC called the REACH program, was Racial Ethnic Approach Towards Community Health. And so we got involved with MUSC, and MUSC started offering more technical assistance and some financial support, small financial support. And we went around different areas, whoever would invite us in to talk to people about diabetes, that's what we did. And as we did it, we got creative and we partnered with other organizations because we know diabetes is a very expensive disease. We've heard horror stories about people who, had to make a decision. Do I control my diabetes, or do I pay my utility bills? Do I, pay my rent, or do I pay my diabetes, purchase my diabetes bill? So from then, we started to do fundraisers, and we started supporting people who were struggling to maintain and control their diabetes because of financial reasons. So that's when we started offering financial assistance to people who wanted to learn about diabetes and learn how to control their diabetes. With all that being said, I know I said a mouthful about diabetes. I just wanted to let people get a little history of how we got started. Because it's very important to us because, like I said, we're a small grassroots organization, and we are legitimately concerned about helping people. Our organization is a 100% volunteer-driven organization. Nobody gets paid for anything, including myself as an executive director. I do not get any funding for doing that. No kind of stipend, no pay or anything. Everything we collect financially goes right back into our program and into the community. So one of the things I want to talk about, how I think the question, how do you navigate the community and get people engaged and start doing these programs like this? Things have changed over the course of the 25 years that we've been in doing this work. When we first started, there were people who were eager to learn. It's just like something new. When something is brought to your attention is new, like, okay, we want to get aboard and we want to learn. But those people then were people who really didn't have the education, didn't have the means and the resources to be educated with diabetes. So once we got set up in our office, we are partnered with the county. Georgetown County gave us our space free, in kind. So we started pulling together support groups. We continue our further training. MUSC continue to offer training to us. DHEC, the state of South Carolina DHEC, continue to offer training to us. So we will be abreast and up on what was going on, the new fads and changes with diabetes, so we can educate those people. And the people we dealt with, like I said, rural communities that was uninsured or underinsured. And then some of them didn't have from a literacy standpoint, to understand what a doctor, when you go into a doctor, that is important to understand what your doctor's saying. And a lot of times we were interpreting what the doctors were saying about their diabetes for them. So as I said before, these people were eager to learn, to find that safe network where they will be able to discuss their diabetes and not feel looked down upon, and like no one cared. So we started in our office, and then after a while, we began to travel from different locations. We went to community health centers, senior centers. We went into the faith-based community. Whoever would invite us in, we were there. And as I was saying before, we were trained continuously through these organizations that we connected with. I also want to bring about to the attention to you, as you navigate through these communities and get these people involved, you have to build that trust with them. They have to understand and know that you have their interests at heart, that you're not just doing that because we've had people come and say, okay, if we let you into our community, we let you into our centers and our churches, I mean, they thought, what are you receiving out of this? And they had to know that we are legitimately concerned about your diabetes and how you're controlling and maintaining your diabetes. They had to know that. And once they saw our concern and our trust in it, they were geared upon working with us. So it's important for you to build that trust, because like, I know I talked about some of them being in a very rural community, but they were people and they knew when you were there for your benefit or when you were there for their benefit. Because they were always their concerns, like, hey, when you come in and get to your numbers, I get your needs, where does it leave us once you get what you need? And, you know, of course, we all know when it comes down to grant funding, yes, you have to have numbers. Yes, you have to report those things to continue to get the funding. When we were always honest with them too, hey, yes, in order for us to get funding to do this program for you, to do something different, yes, we do have to report numbers. But when it's over with, we are here as long as you allow us to be in your community, educating you about diabetes. So that is a key factor when it comes down to navigating the community, building their trust. Once you connect with that community champion or that person, because you know, Ms. Florine is a community champion, and everybody knew because of her work, because she was always a community worker, everybody knew that if there's anything she can do for you, she will, and it wasn't about self. She's a person that, and when she got started, even anybody who she brought into the community or anybody that she wanted to make a presentation to the group, it was people that she knew was concerned about their well-being and their health. So anybody, and like I said, I say that because I really think that's a key, because we wouldn't have survived for 25 years if it wasn't for those people trusting in us and believing in us to help them. Okay. Like I said, just to some of the things that we've done, and over the course of the 25 years, we have changed some things and altered some things because the world is changing. Like I said, when we started out, it was more people who want to learn, who just didn't know, and they were happy to have someone there to help them and to take the time out to show them. But as diabetes is not going away, it's more and more people are diagnosed with diabetes, but now it seems that we have more and more people that are educated, but for some reason are kind of in a denial. I don't want to take the time out to care for their diabetes. So it has become a challenge for us because we can offer things through, because there's always a timing thing. So we had to adjust. So we no longer could do those Tuesday morning classes from 10 to 11. We have to change and conform to what is best for society, now the community. So with that being said, it took going to doing virtual stuff as well, especially since the pandemic. We're doing more evening events as well because most people prefer like, okay, I have to work. So I prefer working instead of coming to a diabetes support group. So, excuse me, which I can't blame them. So we had to adjust on how we present things and what we present because it's still our same goal. Our goal is to educate our community about diabetes because like I said, diabetes is not going any place. It's up to us to try to maintain and control it the best of our ability. And you know, when you're used to doing something for such a long time, it's hard to make that change and modify what is going on with diabetes. So just to capture on a couple of other things that we do, like I said, if there's anybody who is in need of medication and can't afford their medication, we simply do a simple little survey paperwork for them, and we will purchase their medication. What they would have to do, we don't give them the check. We'll contact the pharmacist, and then we'll pay for the medication and have pharmacists have them pick it up from their pharmacy. Of course, you know, with diabetes, a lot of people say, well, I have insurance, but sometimes if you're a person that have diabetes and your insurance only cover a certain amount of medication, it comes a time like, okay, I need more medication, but my insurance is not going to cover it. So I'm going to be without until that next 30 days. Or you may have cases where your blood sugar is not in control and doctors have to experiment. Now, when I say experiment is not the correct word, but they have to change and modify medication. And every time they go back and get that prescription refilled, that's going towards their insurance. So oftentimes we have people come in here and come to us and say, hey, I need your help. Can you help us? And again, if they're sincere about maintaining and controlling their diabetes, after doing a simple consultation with them, we're willing to purchase their medication. And it's not many people that we turn down. And because we are a small nonprofit organization and we don't get large fundings like federal dollars or anything, we always try to recommend the other resources first. And then we will be the last resort because we have to preserve as well. And that's why it's so wonderful also to have partnership with organizations like the Lions Vision Services. So, you know, we can't do eye surgeries. We can't afford to pay co-pays. We have done it in the past, and that's because it was during the time that we were able to do it financially. But, you know, it's important about, you know, diabetes, you know, taking care of your diabetes. I guess I got kind of sidetracked when I saw the question came up into chat. If it's okay, Daniel, can I stop and answer that question?
Sure, absolutely. Yeah, can you see it, or would you like for me to read it?
Read it, please, again. It just popped up. And
yeah. So the question is, I know you mentioned that your founder learned more in the 2 days of the DHEC training about diabetes than she had in 10 years of having the disease. So the question is, what would you say is the number one thing that often surprises people the most in your trainings that they may not have known about beforehand?
Okay, with her situation, you know, because I say in that rural community, especially for African American, they were normally used to going into the doctors, letting the doctors diagnose them, telling them what was going on, instead of them stopping and say, hey, I don't understand this, or hey, can you explain this a little bit more to me? Or, you know, it was cases we've seen, we had stories, well, okay, the doctors just, hey, you're diabetic. This is what you need. Here it goes, I'm writing you a prescription, but never had the time to stop and explain to them, okay, what is diabetes? I mean, what do I need to do for diabetes? And not that I'm bashing any doctors, because I don't, because sometimes it can go both ways. Sometimes, if we don't ask questions, sometimes the doctors automatically assume you know what's going on. You understood what he or she is saying to you. But if you're not a person to say, stop, wait a minute, can you break that down to me in a little bit layman's terms where I can understand it? And then, you know, you could, and it probably would have been easier for them to maintain and control their diabetes. Even her, she said herself, she was eating whatever she want, drinking whatever she want, wasn't caring until she went to that training, and it was broken down to her in a way, in a manner that she could understand what was being done, what diabetes was doing to her body. And once she did that, that was also one of the things that she was advocating for. She was like, okay, you got to be able to ask questions. Here's questions you need to ask. We even had a campaign one time where on foot care, pushing and talking to people about the importance of having your feet examined when you're diabetic. So that was a big campaign for us. And through that campaign, based on statistics and research, working with MUSC, we reduced the rate of amputee among African-American men by 53% during that time period in Georgetown County, because that was a campaign for us, educating them to say, okay, when you're a diabetic, your doctor needs to examine your feet. I mean, when you get into the doctor's office, this was our slogan, when you get into the doctor's office, when they finish, take your shoes off. And when they say, okay, what's going on? Why are you taking your shoes? Aren't you supposed to examine my feet and make sure there's no abrasion or anything on there? And so, like I said, everybody got a whim of what we were educating people on and talking to them about. And so that was something that we talked about and pushed that and talked to them about, okay, ask your doctors questions, no matter what, even if you have private insurance, Medicaid, Medicare, that's why the doctor's there. Don't be afraid to ask questions if you don't understand.
Okay? So Joyce, something that I'm hearing in what you're saying, I just want to repeat it back to hear if this is what you're getting at. It sounds like we need more patient advocacy in our healthcare system, so that somebody is advocating for that patient, for their interests, for their needs, for their understanding during the healthcare process, especially when they might be reticent to articulate questions or concerns to their doctors.
Exactly. Okay. And yes, we do. Even if they don't have a family member who can go to the doctor, I always say, especially for our elderly, make sure you have someone in the doctor's office who understands what is being said to you. You know, at one point in time, I was ignorant about the fact that I thought it was getting better. But the more and more I get back out there and talk to people, it's not getting any better. There's still people going into the doctor's office, leaving out, having a diagnosis, leaving out, not knowing exactly what to do. You know, we went to one training, I think it was here in Charleston, where a patient, they were telling a story, but a patient received medication, a prescription, and it said, shake before taking. And this young man actually got up and was just shaking his body, not understanding. And I know it may sound, some people may think it's comical, or some people may think like, what? But it wasn't the understanding there. So we do need patient navigator and stuff to help advocate for these people who don't understand.
Absolutely. Joyce, there's another question that came in the chat. Would you like to take that one now too?
Yes, that's fine.
Okay. So the question is, do you have classes now to help those who have been diagnosed as pre-diabetic?
Okay, no, I don't do the class personally, but we do have partnership with Tylen's Healthcare. They have the pre-diabetes classes. So what I'll do, like I said, diabetes is so prevalent, we can't do it all. So instead of duplicating services, we work and partner with the other organizations to do it. So anybody come to me that wants to do a pre-diabetic class, we have in Georgetown, it's Tylen's Community Health. The hospital system has a pre-diabetic program. We also have Care Pharmacy, which is a partner of ours. They do pre-diabetes class, and they're certified through CDC. to do these classes. And you know, just to tell you, people who are not from Georgetown County, there's other educational group throughout South Carolina where you can get in contact with, like American Diabetes Association. They are pushing pre-diabetes class as well, like diabetes prevention. You put in your address, a zip code, and you'll be able to find the closest diabetes education group within your community. Also through South Carolina DHAC. DHAC is also a group that still offer diabetes class. And they still do these things, the train-the-trainer workshop, where they're looking for community groups, organization who's willing to come aboard to educate people about diabetes. They would do the training, provide all the technical support they need, and they have specific programs. They have a lot of programs. And, you know, and they also go further into the, because diabetes have comorbidities, you know, it comes with hypertension, stroke, high cholesterol, heart diseases. So all these, there's things that they have that tie in together with diabetes. So there are programs out there. Like I said, right now, the programs that we're doing, our main thing is we provide what we call core kits. A core kit is a nice little box with our logo on there, where we have the glucometer is in there with 50 strips, the lancet, alcohol swab, everything you need to do to test your blood sugar in that box. And we distribute those. What we're doing, we're starting to do a campaign after our 25th anniversary celebration, where I was talking to businesses, organizations, where we would put at least like 3 to 5, depending on the size, kits to have available in case someone needed. For instance, like in the schools, all the schools in Georgetown County, we will go out and provide maybe 3 kits or 4 to each school nurse. So if they come in, a child comes up with a situation where they need to be tested for diabetes, or they don't even have the means of getting the machine and strips, they can distribute it to them. And with our partnership with the pharmacy, Care Pharmacy, you can go back and get those strips. You can get 50 strips for $10, which is a steal, because to get a box of 50 strips, you're paid $20, $30, or even more, depends on what kind of machine you have. And so, you know, like I said, we form partnerships throughout the areas. We even worked in surrounding counties, Williamsburg County, Charleston County, Horry County, you know, and we're one of these groups, wherever you need us, we will be willing to go and support. And like I said, and our support group is basically a virtual group where you come around, we support each other who are living with diabetes. You know, talk about diabetes, because, you know, diabetes affects us in many different ways, not only from a health standpoint, a psychological standpoint, because it can bring about depression. Financially, like I said, it's very expensive disease to deal with, especially if your diabetes is not under control.
I'm so glad that you mentioned that, Joyce. Some of those other groups that people can connect with across the state. We have about 122 Lions Clubs in different communities all over South Carolina. And one of the things that Lions Clubs International has made one of their core focus areas, one of their global causes, is diabetes, because of the connection between diabetes and vision loss. So I wonder, Joyce, if given some of the things that you brought up and some of the other community partners and resources that are out there, if there's a local Lions Club listening to this who wants to do a service project in their community, specifically around diabetes, and helping to bring about awareness and help put resources towards treating diabetes, what would you suggest to those Lions Clubs in South Carolina for ways that they can create meaningful local service projects to help the diabetic community in their neighborhood?
Well, I would recommend them connecting to health facilities, even looking up small groups, because these groups are listed. And like I said, once you put their zip code in, it'll tell you which group it is. And the reason why I say walk, especially the community groups organization, is again, because people, when they are willing to work with you, you get better attendance, and better support when you connect to those groups. And if there are organizations like ours, we're willing to help anybody who wants our help. We'll go wherever we need to go, whenever we need to go, and we'll be available to help you.
Well, Joyce, you've got a request now. There's someone asking if you would be willing to come speak to the Georgetown Lions Club.
Sure, just get with me with the dates and time, and I'll go through my calendar and make it happen for you.
Awesome. We'll be sure to connect y'all afterwards to get that set up. I know that the folks in Georgetown there would love to hear more about this.
Great.
I wonder, yeah, go ahead, Joyce.
No, go ahead. I said it sounds great.
Awesome. What does, I wonder if you could help us in thinking about these partnerships that are so important in this work. What would you define, Joyce, as a successful partnership for the Georgetown Diabetes CORE Group? What does success look like for you all when you have groups coming to you and offering to partner, or when you try to partner with others? What does success look like?
For me, success means that we are taking care of the community. People are learning about their diabetes, learning how to control their diabetes, having less hospital visits. I mean, and we're making a change in their lives. They're making behavior changes. And to me, I think that's very successful because we're more, of course, you know, everybody will say the finances. Yes, we do need finances to support these programs. But this making that change in people's lives so they can live longer, healthier lives. That's, to me, is successful. When you hear these stories, when people come back and say, hey, because of you, my doctor has reduced my diabetes medicine. I no longer have to take insulin because of the lifestyle change we made through you advocating and supporting us with changing our eating habits, becoming physically active. To me, that's what success is to me, that we've reached people and they're making a change in their lives and they're learning and understanding diabetes and what they need to do to live with it. That's success for me.
Awesome. That's fantastic. A very clear definition of what success looks like there. That's great. Joyce, you talked about the importance of trust, and you talked about the importance of finding those local leaders in the community to connect with so that people understand that an organization has those individuals' best interest at heart and not just the organization's interest at heart. Joyce, I wonder if you could share any insight or experience that you've had in how do you find those informal community leaders? They don't have an official title or an official position somewhere, but they're the movers and shakers. They're the ones when somebody talks to them in the community, they listen, they're respected. They may not be visible publicly, but they are powerful forces privately in helping to protect that community and help to connect individuals in that community. How do you find those informal leaders?
Well, you know, for us, I think when you invested in the community, when you go out and you got to be around them, visit their different events and activities going on, and you'll pretty much get to pinpoint who the movers and shakers are in their community, different activities they may be having in that community. For instance, if I wanted to target a community, I start attending events in that community and to find out who are the movers and shakers in the community, who is that gatekeeper that everybody trusts and respect. And once I find out, I have a conversation with he or she and offer our program and say, hey, this is what we have to offer you, you know, and see whether I can get them to buy in on it. Because, you know, really, I need them in order for my program to be successful. You can't have a program. I mean, you can have the funding, but if you don't have the people, what good is your program? So that would be my suggestion. Connect with people who are in the community, or for yourself, go into the community and get engaged and attend the events. It may be the worship services. Just like I got invited to the Lions Vision Service, go a speaking engagement, and you kind of see who are the movers and shakers, who can make things happen in the community, who can build that trust for you in the community, and you connect with them. Because you'll know when someone is sincere and have the people's interests at heart.
Definitely. It comes across pretty quickly in conversation.
Exactly.
Joyce, another question from the audience here. Do you have separate trainings for individuals with type 1 versus type 2 diabetes? How does that treatment and management differ?
Of course, you know, with type 1 diabetes, you're insulin dependent. You need your insulin in order to continue on. We can, like I said, because on the education part, I refer those to the other organizations, like I said, Thailand's Smith Medical Clinic. They're partnering with it. They have a diabetes educator that comes in that works with us as well. I would, we could always specify and say, hey, this is what this organization, this group needs. I have about 5, 6 people who want to be educated on just type 1 diabetes. How do you control your type 1 diabetes? And the only difference, the biggest difference is type 1 diabetic is insulin dependent. They have to have their insulin. I mean, the education can be pretty much the same. It's just understanding that you cannot go without your insulin as a type 1 diabetic. Of course, type 2 can't go, but it's more detrimental to a person with type 1 diabetes. But like I said, on the educational part, we have referrals. We collaborate with Thailand's Health, Smith Medical Clinic, St. James, all 3 of them, any one of them, we can pencil you in there and meet with them. Even if we have to set it up at our office with them leading the training, we can do that as well.
Wonderful.
And I also wanted to mention one of the new things that we're working on now. Being during the pandemic, a lot of the doctor's appointment was virtual. We're in the process of setting up virtual doctor visit for those who don't have a means to, know how to get online and do a virtual meeting, a virtual doctor appointment. They can come to our office, and we have an office set up with the computer, laptop, where they can get on and have their virtual doctor's appointment, and with the assistance of a volunteer. Volunteer, unless they sign a consent form and say the volunteer can be in there to help them through the whole process, we'll have someone there available to assist them with their virtual doctor's appointment. We have not finished, we haven't done it yet, but we're in the process of doing that. We call it Telehealth Tuesday, because mainly on that day, that'll be a day that they can come in the office and do their virtual doctor appointments in our office.
That's wonderful. Telehealth and virtual medicine is just increasingly the wave of the future, it seems. So that's great that y'all have those programs coming up.
And we do have a fitness program we call Workout Wednesday, where every Wednesday from 5:30 to 6:30, a group of people come out and do aerobic exercise every Wednesday. And one thing about our organization, everything we do is free. We do not charge our guests. We don't charge for the fitness class. We don't charge you for the kits. We don't ask anything from you. The only thing we may ask you to support the event with your presence, or sometimes if we have an event, like we have our 25th anniversary gala coming up, we would like to see people in attendance if they can come.
Definitely. Or sponsor the event if they feel so inclined.
Exactly.
Right?
Or sponsor the event. Thank you, Daniel.
I'll throw in a little fundraising plug for you there.
Thank you.
Joyce, one of the reasons that Lions Vision Services is so concerned about diabetes and is trying to be more intentional about engaging the diabetic community and providing more resources for our own patients is because of the connection between diabetes and vision loss. I wonder if you could speak a little bit to what you have seen as the primary vision needs in the diabetic community? And what do you anticipate those vision needs will be in that community moving forward in the next few years?
Okay, thank you, Daniel. As he was saying, diabetes vision loss is very prevalent among diabetes. Diabetes does affect your eyes a lot. On an average, I know within the course of a month, I do encounter several people who may be experiencing problems with glaucoma, cataract surgery, need to have cataract surgery. It's just it's just amazing how many people you would come in contact that needs to have cataracts removed from their eyes. And I think it is increasing, and it's very important. And that's one of, like I said, that could be an education series itself, just the eye care from being a diabetic. So Lions Vision Service, we appreciate your service and the partnership you have had with us, because I've had several people come back to me and say, thank you for connecting me to the Lions Vision Service, because I wouldn't know what I was going to do without their help. And that's one of the main reasons a lot of people don't even consider eye surgery to have cataract removed, because the cost and expense to having it done. But it's very important that they have it done. So I say thank you, Lions Vision Service, for helping people. And like I said, it's more and more each day. And I said, I run into so many different people that have to have cataract surgery removed. Only thing about it is just getting them to follow through with the process and getting it taken care of.
Yeah.
And it is increasing. And that's the only thing. It is increasing tremendously. But just to have them follow through, staying on them to follow through with the process to get everything taken care of. And that's one of the biggest things I've seen, not just with you guys, it's just in general, giving them the information, but being able to follow up with them and say, let's follow through with the process to have it taken care of. I mean, I hope I kind of answered your question. I know I kind of deviated from it a little bit, but yes, it's very prevalent now. Yeah, and it's going to get worse, because even, and I tell people, diabetes is is strenuous for eye care, because after a long period of diabetes, dealing with it for years and years, it just damages different parts of your body. Regardless, it's going to happen. And seems to be that the eyes are one of the things that normally most people deal with first. Blurred vision and losing their eyesight because of diabetes.
Absolutely. I mean, that's one of our main talking points at Lions Vision Services is, if we can correct that vision issue first, that will better enable individuals to manage their diabetes, to manage their insulin, to manage getting to the grocery store, to manage getting to doctor's appointments. It breaks down a lot of barriers to be able to do that. And we're incredibly grateful for our partnership with Georgetown Diabetes CORE Group to help connect us with those individuals that need those services. We share the same challenges that you do in getting that follow through to happen. That's a perennial challenge that we just continuously encounter, but we've got to keep at it. There's people that need these services that are depending on it. Joyce, there's another question here, very relevant to our current situation. How has the coronavirus impacted the prevalence of diabetes in the communities that you serve?
It has impacted it tremendously. One, I knew we couldn't get out and do what we used to do. We're just like this past year, and finally got back into really doing the swing of things with diabetes. And educating. And COVID has really, just like everything else, has really impacted the diabetes community. We tried what other organizations to do little virtual things to try to keep them abreast of their diabetes. But again, you still have a large population who's still battling the Zoom process and the virtual process. it was challenging, and that should have been a time that we were really hitting it hard because people didn't understand that they were at great risk for attracting COVID because of their diabetes, and diabetes would affect them much worse than they do with people who are non-diabetics. So it has been very challenging. And, even after, the pandemic, we still faced with another strands of COVID. And it seems like it's challenging really getting people out again and comfortable. We're doing the Zoom, we're doing virtual, but like I said, it's still that population. As long as we were doing Zoom, they still have challenges getting on virtual, on the phones. So it's just like, and COVID has left us with a lot of work to do. We got to do a lot of catching up to get people back on track. But for some reason or another, and like I said, I alluded to it earlier, as time changed, you think that people are better educated about diabetes. But I just got a rude awakening a few months ago after we first started with our support group back in person. I was just amazed that we had a new group of people who didn't understand the importance of checking your blood sugar, didn't understand the importance of why you should be drinking a lot of water. I mean, it's just like, I was like baffled or blown over because it's still a lot of work to do for diabetes. You would think that they have advanced a lot more, but no, there's still a lot more people who don't really understand really the effect diabetes have on them. So, a lot of people, I have a couple of members or volunteers that say, well, hey, this organization is doing the same thing you guys do. And I was like, hey, I welcome as much people as possible to do what we're doing because there's a great need out there for diabetes. There's not enough people who can do diabetes education to the point where we can just kind of eradicate that disease because it's too much work. And you can do series. I think every month I can do a series on different things, how diabetes affect you, how to maintain a match. It's just so much. So we need all the help we can. And like I said, I think COVID kind of set us back, in trying to get people educated again.
Absolutely. And there's always a new generation to pass that education baton on to. There's always more awareness that needs to be done, and the sooner the better.
Yes.
Joyce, I wonder if you could talk a little bit. You work in some of the rural areas of our state, Western Georgetown County, Williamsburg County, and I'm sure that you're familiar with other rural communities. What are some of the unique challenges, but also some of the unique opportunities that exist for diabetic education and community engagement in those rural communities specifically?
Okay. Rural community, transportation is still a challenge. I mean, although, one of the things like in the rural Northwest part, they put the new health facility up there some years ago, but you still have other people further away. I mean, it's close there, but you still got other population, pockets of communities that, getting there is a challenge. And then I know there's transportation services now, but there's still people don't understand and know that, oh, if you have Medicaid, you can schedule a ride to your appointments, or if you have Medicare, not understanding that process, you still have that as an issue. Transportation is still a big issue. Also, the education level as well, being in a rural area, because Georgetown, is very rural. I mean, this areas that you're like, oh, this area still exists. And just to see there's still parts of Georgetown County that seems like it still have to play catch up with the other part of Georgetown County that is in what I consider rural area. And just so many understanding. It's just like communities that people, it seems like we have forgotten about. So you have to start back with the very basic. And and the educational level is different. And if you don't know, you don't know. because
Absolutely.
that was one of the things we first started with. You know, we talk about education, but you got to really get down in there to get these people. Um, we can't stay within the city limits, or we can't say, "Oh, that's a health center there." There's people out there that probably don't even know what that health center look like because they can't get there. They just don't understand. And you know, and I have this thing now to say that we become a product of our environment. So people are in situations like that, having children that is growing up in the same situation, not having the education and availability that others have. So it's just like history repeating itself,
Yeah.
even with the newer generation, because they only go do what they know and what they are accustomed to.
Yeah. Absolutely. Challenges that we will all continue wrestling with and working our way through in the weeks and months and years ahead. So, Joyce, as we come up to the end of our time here, I wonder if there's anything that you'd like to leave the group with about how to follow and stay connected with and support the Georgetown Diabetes CORE Group specifically.
Okay. Thank you, Daniel. And again, I say thank you for having me on. Thank you for the Lions Vision Service for the work you do in the community. I really appreciate you as well. Just want to let you know, for the Diabetes CORE Group, we are, when you see us out there, please join in. We don't discriminate. We take any kind of assistance, support, volunteers. We really need volunteers because, again, like Daniel said, we need these patient advocates to help them through the process to make it a little bit easier for them. Support our programs. Anybody you can refer to me, please do so. We are always willing to help. With our fitness classes, our support group, the telehealth Tuesday, whatever we're doing in the community, our core kits, we always tell people, sponsor a kit. Purchase a kit and say, hey, this is a kit for an average kit. It's about only $25 for a kit that we put together. Sponsor a kit. I want to leave you with this. On September 10th at 6, we will be celebrating our 25th anniversary. This is the Diabetes Gala. We've been around for 25 years, this small little grassroots organization. You know, we've traveled around the world, did many different things. You know, in an organization, I think it says a lot for us for 25 years in a small group, doing what we do, working hard for the community. It's all about our people and educating them. Come out and support us on September 10th if you can, or if you know somebody who's in the area. If you're not in Georgetown, just reach out to me and come out and support and see the things we do. And know that everything you do and we give goes back to the people, not us, to the people in Georgetown County and surrounding areas. And again, I say thank you, Daniel, and thank you to the Lions Vision Services for all you do.
Well, absolutely. Well, that thanks goes right back to you, Joyce. We thank you for your time today. And I would just encourage all of our audience members and anyone listening to this down the road that take Joyce up on those opportunities. Those are incredible ways that we can help support the community. And one of the things that I've appreciated learning, Joyce, as we've been able to work more together over the past few years is just the extent to which this incredible group here in Georgetown that you have has reached so many people. 200,000 people over the last 25 years, being named one of 18 centers of excellence in America. You all are doing some incredible work there in Georgetown, and I hope that that serves as a model and encouragement for others around the state. I hope that Lions Clubs will stay involved and will take up the cause of diabetes awareness and prevention in our communities. And we just invite you to continue following what we're doing at Lions Vision Services. You can sign up for our monthly e-newsletter on our website. That's lionsvisionservices.org. You can also find us and follow us on a number of social media platforms, including Facebook, YouTube, LinkedIn, Instagram, Twitter, and we will have this recording available on our YouTube channel. for future reference and for future use. So thank you all so much for taking your time to join us today. Thank you again, Joyce, to our speaker and to our partner in service, and have a wonderful rest of your day today. Thank you so much.
Thank you. Goodbye.
Take care.
Bye.